So welcome. This is Denise Noyer Erez with AIM Wellness Clinic, and I am excited to host this teleseminar webinar with people that specialize in fertility as well. And so welcome to our Aim to Get Pregnant teleseminar webinar. My intention for you is for you to discover, get some insight about how your body is and become more informed about fertility and testing of fertility, so maybe it doesn't feel so scary, and that you can make your own decision based on where you are today, and to give you some coping mechanisms that can help support you until you do conceive. So now it's my turn to talk to you and share a little bit about what I do and how you can supercharge your fertility. So I'm Denise Noyer Erez, and I'm also been called the fertility godmother because what I do is I like to help take people under my wing and really help them and support them on their journey so that you get the best steps and you don't waste any time. Just a little bit about myself is I studied exercise physiology and nutrition as my undergrad at Cal State Northridge, and I was always interested in health and wellness and preventative care. And when I finished school, I wasn't sure what I wanted to do, so I want to say divine intervention, if you will. I ended up at Chinese medical school. And honestly, I really struggled with Chinese medical school because it was so different. And I have this science background where I like to see how things are working. So I wasn't sure I was going to actually practice, but somehow I finished. And at the very end, I was blessed to go to China. And in China, I saw how they integrated the Chinese medicine, the herbs and the acupuncture into the hospitals. And that is what really encouraged me to do something that I wanted to do, and where I have this beautiful medicine and to work with doctors so that we can create a holistic, really serve our couples or women and men at the best, at the highest level. So that's a little bit about me. So if this talk is for you, if you are tired of sitting on the sideline and just waiting for that special moment when it's your turn to have that positive pregnancy test. And this talk is for you if you're tired of being disappointed and want to start doing something different. And this talk is for you if you're looking for natural steps that you can take so that you can hold your own baby. So today we're going to discover how you'll supercharge your fertility. Specifically, what I'm going to cover is what your cycle is telling you about your chances of having a baby, when the best time to have sex is, because timing is everything, and how to recognize positive changes. I'm going to teach you as much as I can with the limited time that we have, and then I will promise to show you how to take it further. So in my clinic, we see tons of women who really want to get pregnant, but their bodies just aren't ready. They've either gone through multiple IVFs and they haven't worked, or they've been trying for years and things haven't happened yet. They're super, super stressed. They're maybe not sleeping right. They probably aren't eating right, or some of them even do research and think that they're eating right, but aren't really eating to nourish their bodies properly to have a baby. And, you know, as we've heard and as you probably have experienced, we think that having a baby should be easy because it's natural, but actually it's very difficult. And a lot of things have to happen just right for you to get pregnant. And if just one thing is out of whack, then the whole process could be interrupted. So your monthly cycle is a huge clue to what's going on in your reproductive health. Okay, your period gives some valuable information of that is indicative to your fertile potential and your chances of conceiving. So a normal cycle is usually around 28 to 30 days. And then Dr. Winkler said 24 to 35, I think. But from a holistic point of view, we actually feel that it's really important to be closer to 28 to 30, 29 20 days. And the reason that is because during your body needs to prepare the egg. And if your cycle is short, then your body doesn't have enough time to prepare for a healthy ovulation. And in fact, there's a lot of studies that show with short cycles, it's especially detrimental to your conception. It decreases your chances of getting pregnant from 50 to 75%. And also, if your cycle is too long, over 31 days, then there might be some imbalance in your hormones. And the egg is, you won't have a strong ovulation, or the egg gets too ripe before it's released. So you can have a higher chance of miscarriage due to a chromosomal abnormality or some other type of imbalance. The good news is that if your cycle gets back into balance, then your pregnancy rates return to normal. So from a Chinese medical point of view, we break the cycle into 4 phases. We have the period, we have a post-period, an ovulation phase, and then a follicular phase. And depending on what's going on with your body is how we do your treatment. So let's talk about your menstrual cycle first, okay? So what's important to us when we look at your menstrual cycle is we look at the amount of blood, the quality of your blood. What color is it? Do you have any clots? What's the texture of your blood? Is it thick and sticky? Is it too liquidy? It gives us a lot of valuable information. Are you having any pain or discomfort? How many days you're bleeding? And if you have any spotting before or after your menstrual cycle. So what it should look like is you should bleed for about 4 to 5 days, and you should have a nice, good flow. And the blood should be nice and red, not dark brown or sticky or purple. Nope. And you shouldn't have too many clots. Also, as far as pain, there's definitely a lot going on down there. And so it's normal to feel sensation, but you should not have pain before or during your menstrual cycle. That's an indication of an imbalance and something else going on that should be corrected. If you don't bleed for a good 4 or 5 days, then that's an indication to us from a whole Chinese medical point of view that you don't have enough blood to nourish the uterus or your eggs. So there's a deficiency there, and we really focus on building up. And the same thing as if you were bleeding too long and you were having these really heavy periods, then we would and say that you didn't have any fibroids, as we definitely want to make sure that that was ruled out, or any cyst. But if your body was bleeding, having really heavy painful cycles, then there would be an imbalance that would need to be corrected. Okay, so let's talk about the post-period. So you start bleeding, sorry. So around your menstrual cycle, and you start shedding around day 1, you start shedding the lining. And at the same time you're shedding the lining, the second day, your body's already starting to rebuild itself. And you want to make sure that you have a nice, good flow. And then in the follicular phase, not only is your body losing the lining and giving a chance to regenerate, so you have another chance this next cycle, but your body's also starting to produce follicles to get ready for ovulation. So even though you're bleeding, your lining's regenerating, now you're also producing cycles. And what happens when you ovulate is your body has already recruited the follicles that it's going to ovulate this cycle. So there's like this race that's going to happen, and your body, your ovaries and your brain are communicating, and most people generate, as Dr. Winkler said, anywhere between 2 to maybe even 40 follicles that cycle. So your body's recruiting all the follicles to grow, and the race begins. And then around cycle day 7 to 11 is when your body decides who the winner is, and the winner gets an all expense paid into the fallopian tube. And that's decided around day 7. And so what happens is, after the winner is determined, all the other follicles start to degenerate and get absorbed back into the body. And this allows the body to really nourish that one follicle and that one egg that's growing in it, to be strong and healthy. And then usually around day 14, it's like 5 days later, your body, the follicle will be large enough, which is usually around 24 millimeters, and it'll erupt and the egg will pop out. And this then at this time, the fallopian tube actually moves closer to the ovary, and it has these little fingers on the end, and it grabs the egg and pulls it into the fallopian tube. And at that time, it would be ideal if the sperm were already there waiting to fertilize it. So that would be the most successful chance of having a successful fertilization, if the sperm were there already. And it's really important as well. We tend to focus a lot on the women, and I was so happy to hear Dr. Winkler emphasize a little bit about the men, because the male sperm is 50% of making the baby. Each of you will give 23 chromosomes. Each of you are very important for the DNA that you're going to give your baby. And I love that she emphasizes that. And I also want to support that as well, is that it's important for the male to be really healthy and have strong sperm too, so that you can fertilize the egg. So if the egg doesn't get fertilized, then it'll just pass down the fallopian tube, and then you'll have a menstrual cycle. Your body will be signaled that it didn't work this time. Let's restart and try again. And then the whole process will start over. So what happens is, when I see a lot of women who come in, and it's not really said, but there's a sense that women don't really understand how the ovulation process works, and some things that they can do different. So if you will, this is a little bit of my soapbox. What you can do is, let me back up. Women tend to think that they just ovulate right away. An egg just pops out, and if you will, and they have sex and are supposed to get pregnant. But if you think about it, there's actually a lot of talk, or there used to be more, about preconception care. So we are born with our eggs, all of our eggs that we have. And they're just sitting there sleeping, or they're dormant, until our body recruits them. And every month, your body starts to recruit a certain amount of follicles. And it actually takes 13 months. Once your body recruits those follicles, it takes 13 months to actually ovulate that egg. So it takes a lot of time. It doesn't just happen overnight. And there's even another optimal window before, which you guys have heard of as preconception care, which is why it's important to be on prenatal vitamins and folate and choline, vitamin D before, because we were able to dissect those certain parts and find out that they're really important to the health of the baby and the health of the mom. And if we were deficient in those, it caused birth defects. So, but from a holistic point of view, we look at everything in different ways to really help you optimize that period. So there's a 3-month period, and that's really where I created our Aim to Get Pregnant programs from, because during that window is when the egg actually starts to grow inside the follicle. And so that's an optimal time for you to really get healthy, really balance your menstrual cycles if they're off, or really help increase healthy blood flow into the uterus and the ovaries. It's a really optimal time for you. And the same as for the male partner, usually men are constantly regenerating sperm, but it takes about 90 days to recreate new sperm. So that's also a great opportunity for them to get really healthy, to be able to give the best DNA possible, or have the best sperm if you're getting available, if you're preparing to either conceive naturally or even with IVF. Okay. Okay, so let's talk about the cervical fluid. So Dr. Winkler touched on it a little bit. I'm going to just go into it a little bit more depth. So the arrival of your fertile mucus is a sign of the fertile time of the month. The fertile mucus is evident. It can be evident for a few hours, or it can be evident for a few days. So you can imagine the longer, the better. And it's really important to have fertile mucus because it maximizes the survival of the sperm and encourages the entry into the uterus. There are 4 types of cervical mucus. There's the G type, which is in the beginning of the cycle. We call it the gate, and it's really dry and pasty, and its purpose is to block the sperm from entering the uterus. We're closed for business. And then as you go into the cycle, maybe around cycle day 7 through 11, we start to get that creamy mucus or discharge. And the purpose of this is really to filter out any of the abnormal sperm or poor quality sperm before it can reach the uterus. So you can imagine the sperm really needs to be strong and healthy to get through some of these barriers. And then the fertile mucus, the S type or the spin barky, is that egg white, stretchy, slippery mucus. And this is your clear sign of ovulation. This is the optimal time to have sex. And the purpose of this is really, it actually creates these pathways for the sperm to move up into the uterus. And at the same time, it also nourishes the sperm. And then you get a P type of mucus, which is really slippery mucus. And that is usually the day before the eggs actually release. And usually you have about 24 hours. The sperm has 24 hours to fertilize the egg in order to make a baby. So some things that can affect fertile mucus or your cervical mucus in general are antibiotics. It can change the pH in your vagina, and you have an increased risk of yeast infection, or changes the pH so things are a little bit off down there. NSAIDs such as Advil or Tylenol, they actually lower prostaglandin levels, which means because it wants to reduce pain. You actually need this inflammatory response to ovulate, and NSAIDs can stay, the effect of that can stay in your body for up to 10 days. Antidepressants, it changes the patterns of your fertile mucus. Antihistamines, it dries all of our membranes. So not just in our nasal cavities, but all of our membranes. So you can imagine things being a little bit more dry down there. And also Clomid, because it blocks estrogen, it inhibits the mucus so that it can bother and can influence your fertile mucus. Okay, so to see changes in your cycle, you want to pay attention to your menstrual cycle. You know, again, you should be having fresh blood, no clots, and you can actually watch changes if you have difficulty with your menstrual cycle. Or you can, same with ovulation, pay attention to your fertile mucus, making sure that you have a good amount of fertile mucus. And then one way we like to change or track our is using a basal body temperature. This could be good information for you, but in particularly, I love to use it because it gives me a little bit more subclinical information, and we can track another way of tracking progression in our clinic. So this is what a normal basal body temperature should look like. The nuances of taking your temperatures is you have to take it every morning before you get out of bed, and you should have uninterrupted sleep for at least 4 hours. You can take it orally, or you can take it vaginally. Supposedly, and I haven't played with this yet, but vaginally may be more predictable. And it's something we're going to experiment with in this next month. So I'm just sharing with you. So if that's something that you want to do, you can try that. So this is what we have, a normal BBT chart on your screen right now. And the first part is your period and your post-period. And then you have the dip and the spike. And that means that you've ovulated. And that dip and the spike tells you that you've already ovulated. So if you're using this for birth control, it's not the best measure. But we're really just looking at it for clues to see what's going on in the body. And then technically, during the luteal phase, your temperature should be over 98.3, plus or minus a couple points, but in general. And this will give us an idea of how we can help nourish your body, whether it's warming you up, helping you eat certain types of foods, going through acupuncture, some herbs, sometimes meditation and breath work, just depending. We try to find all types of ways to help support you. Denise, okay. So this is one of our patients that we had. This was the first one on the left here. You can see how different it is from what it's supposed to look like. It's really up and down and all over the place. From the first half, she ovulates pretty late, and then it's kind of up and down again. Then the second cycle, you can see it's still a little bit up and down, but after she ovulated, it continues to go up. So that was just in 1 month of working with the patient. You could definitely see there was some changes there in the second half of the cycle. And so what I just shared with you was the first step in our Aim to Get Pregnant program. And we also really talk about your journey and what's been going on with you. We make sure that you have a Western diagnosis, or we'll recommend what test you should have so that we know we can move forward. There's nothing that I definitely don't want to waste anybody's time. It's a very delicate time in someone's life, and timing is crucial. So it's really important that we make sure that you have all the proper tests, because if you did have a cyst or a fibroid, then we really can't help you. If you had a blocked tube, we need to correct that. And a lot of times we work together with the doctors, so we're helping, balance doing other things with your body at the same time. We're finding all that information out. And then our second step is really we do for not everybody, but for I'd say about 85% of the women that come in, and we try to always get the husbands on board, is we'll do a gentle cleanse. And the purpose of the cleanse is to really launch you into healthy eating habits fast. And even just doing this one step, we've had so much success and people just feeling so good, and it helps them change emotionally, and it's been a wonderful part of the process here. And then we focus on rebuilding, and we'll educate you on supplementation, if Chinese herbs and other ways. And we're constantly balancing your body, nourishing your body, making sure that you're getting healthy blood flow, stimulating the ovaries so you have a strong ovulation, fertile mucus, so that everything is looking optimal. And at the same time, usually in our office, we usually give tips to help the partner, whether it's nutrition or supplements. Sometimes it's herbs. We usually do some Skype calls, because most of the patients we see, it's really difficult to get the men in. And that's okay, as long as they're doing something to be really healthy. Sometimes that works, and sometimes they need acupuncture, but for the most part, that's what we find to be successful. And then we're constantly helping you stay on track and reevaluating. So I know we covered a lot today, and in honor of you investing your time, and especially with all your patients, I'm going to offer you to have a private one-on-one. Aim to Get Pregnant strategy session with me at no cost. And this is a one-on-one session. It's a value of $250. And during this session, we'll meet for an hour and we'll assess your current situation and determine what the best next action is for you. Okay, so we'll send you an email and with that link if that's something you're interested in. But there is a catch. You do have to qualify. So if you're interested and you'd like to do that, set that up, just fill out the form, send it in, and then we will make an appointment with you. We only have, because I am giving a whole hour of our time, we only allow 4 of these per week, and 4 of these per month. So, and we'll be giving those appointments on a first come, first save basis. Is that right? Did I say that funny? Anyways, a first come is, yeah, you know what I mean, I hope. So anyways, thank you again for investing your time today. I hope you got some valuable information and we were able to create some hope, give you some information about fertility testing. Maybe you have more insight about what's going on with your body, when to have sex is, when to take a good break, and try to keep things exciting. And what's important, I know this can be a challenging time, or hopefully for some of you, it's an exciting time. But, just remember that you're important and your relationship is important. So make sure to get the support that you need. And thank you again for coming. Keep your eyes out for the emails with all the information. Take care. Have a good day.